Breastfeeding is something which is the most important gift a mother could give to her baby. There are so many important factors which make us understand why breastfeeding is so important. We give immunity to the baby so that he or she doesn't fall prey to common infections. Baby's growth and its nutritional requirement are well met when baby is breastfed. So the composition of breast milk is made such by the Almighty that breast milk tends to satiate the hunger as well as thirst of the baby. So both get satiated. The nutrition, the calorific value of breast milk is very good. It is somewhere between 67 to 70 kilocalories per 100 ml, which is very apt for the nutritional requirement of the baby. It also has every kind of micronutrient like calcium, like iron, which is required for normal growth of the baby. Breastfed kids are very smart kids, and they tend to have these lifestyle diseases like blood pressure, liver disease, heart disease, diabetes. The frequency of these diseases happening to breastfed infants is far lesser than those bachus who are top fed. So a breastfed baby will be a lean baby, a mentally very sharp baby, not a very fat baby, but yes, lean baby, smart baby, and a neurologically very sound baby. So my recommendation is don't give anything other than breast milk for the newborn till 6 months of life. Every newborn, so this is a very natural phenomena that the baby will be latching, will be feeding, and once he or she has his tummy full, they'll leave the breast. So that becomes the end point of breastfeeding. So initially, in the first month, there will be repeated cycles of breastfeeding, which will even tire the mother off. She'll be very tired feeding the baby because they'll feed very early, very frequently. With time, the feeding the the feeding duration will tend to decrease. Also, as baby grows 1 month, 2 month, 3 months, the duration of two breastfeed will tend to increase. We recommend breastfeeding till 1.5 to 2 years of age. But practically, after 1.5 years of age, baby is well matured to have top food rather than breast milk, because breast milk becomes gradually incomplete after 6 months of age. So we advise complementary feeding and weaning to the baby after 6 months of age, and we continue breastfeeding till practically 1.5 years of age. The first and foremost thing is baby will be quite very irritable when you find that baby is not able to feed properly. So the baby will be cranky, will be irritable. In the initial first 3 months, there is a weight gain, very specific weight gain pattern of at least 600 to 900 grams per month. So if your pediatrician, whosoever is seeing the baby, finds that weight gain has been inadequate and it is not happening as per what I am telling you, is the first sign that breast milk is either it is inadequate or there is this improper latching which is happening and baby is not being able to be breastfed properly. So weight gain is something which tells us, which gives us a very fair idea of inadequate breastfeeding. 6 months of age should be exclusively breastfed. Whenever the baby is 6 months and 1 day old, the visit to the pediatrician is a must, because the doctor will be able to tell you in the very right way how to give, what to give, when to give, and how much to give. These are the four important areas of concern whenever we tend to counsel the parent for weaning. So, the science behind weaning is, since milk is highly incomplete after 6 months of age, so we need to introduce solid foods. So solid, we usually start with one kind of a cereal at a time. We tend to give it in the early hours of the day. So morning is preferably a good time to introduce the weaning food. Give it in very small quantities initially, 2 to 4 spoons in the initial few days, gradually increase the amount of food that is being given to the baby. So 2 spoon, 4 spoons, 6 spoons. So that way you need to grow the amount of food that is being given to the baby. And gradually, once the baby starts to accept it once in a day, after 15, 20 days, start the second food. Always try to mix and match the foods. Keep changing the taste of the food. Keep changing the consistency. It should be a paste-like consistency, but don't try to use blenders, grinders, mixers. Introduce different food items at different times so that baby starts to enjoy their. Usually, there is no obvious reason for decrease in breast milk. If the mother is feeding the baby properly, the attachment, the latching of the baby is proper, the there is no pain while feeding that is happening. Baby is tend to getting the baby feeds for good 10 to 12 minutes for every feed and then sleeps properly. Urine output is good, weight gain is steady. So these are the indicators of proper breastfeeding. Improper breastfeeding, baby is cranky, irritable, weight gain is poor, urine output is less. So whenever these happens, we should understand why is it happening. Is it because mother is the position of the latching, the latching process is abnormal, or there is some kind of a local issue between the oral cavity and the breast, the nipple. The common conditions are the nipple could be flat, nipple could be bruised also at many a times. So nipple gets sore, so mother is not able to breastfeed the baby. At times, nipple could be large in size. Baby is not able to take the nipple inside the mouth. So the feeding is not happening properly. So we need to understand what is the cause and we need to address it then. So it all depends upon what kind of a factor is present which becomes a barrier between an effective breastfeeding process and we address it then and there.